Yeah, so to revise the cut glean, it's called C4. You cut the gleam, okay? So the
Mm-hmm.
C, it's for CBC, CMP, chest X-ray, and beta HCG, CG, okay? U
Okay.
for urinalysis, T for TSH, G for finger stick glucose, L for lipid profile and LFT, E for EEG, the other E for ESR, ESR EEG, M for magnesium, and then when you order magnesium, you order phosphate too. Okay?
Okay.
Okay.
And
Hmm?
the other one, just quickly, the LF, LFT. Wait, hold on. Lost my. The police. BS was for pulse ox, oxygen, IV fluids, IV access, C4 cardiac monitor, and then EKG, blood pressure monitor, and finger stick as well, right? The ER order one.
Yeah, the police BS, P pulse ox, O for oxygen, L for intubation, IV access, IV fluid, C for cardiac enzyme, cardiac monitor, cardiac enzyme, B for blood pressure monitor, S for finger stick glucose. Admit, V panic, V vitals, P pantoprazole, activity, NPO, input output, C for pneumatic compression, N for NPO, B the pre-op, okay, B for the blood type, C for cardiac enzyme, P for PT, PTT, I for IV excess IV fluid, P for pre-op antibiotics, okay, and E for EKG, T for tumor marker. Okay, now so let's continue with acute appendicitis case. So first
This is
you
still
wanna do
UWorld.
focus physical,
This is still UWorld CCS. All right, so focus
Okay,
physical.
so acute appendicitis, first you start focus physical and then you transfer to the emergency room. You do the police BS mnemonics, okay, IV fluid, and then you order the cut gleam, okay. You order a FOBT abdominal ultrasound. The specific one is abdominal ultrasound, abdominal X-ray. Okay, you do NPO, PT, INR, PTT, LFT, urinalysis. Yeah, those are all in the mnemonic. And then you want to give morphine, Phenergan. That's an important one. Okay, and then get the CBC and once you get the result, get some results. Get CBC results. After that, you give IV cefoxitin. Okay, and consult surgery. After that, get consult recommendation, and then you want to order laparoscopic appendectomy. Okay, and then you want to admit V-panic, order V-panic. Okay, and get surgery done, and then you want to follow up Q 4 to 8 hours, and then you want to cancel NPO IV access and order normal diet. Okay, and counsel. And that's the summary of acute appendicitis case. Now let's do the other case, which is called, let's do septic arthritis of left knee. This is how you want to work up septic arthritis. First you do focus physical exam, and then you want to admit because this is serious, and then order V panic
We admit to ward
plus
or
cut gleam, huh?
admit to ward.
Yeah, to word. When I admit, I'll write admit. Doesn't mean word. If I want to send to the ER, I'll write ER. That's it. So then you want to order cottoglene plus something important. You want to type synovial. You want to order everything about synovial, like gram stain, crystal, culture sensitivity, viscosity, okay? Synovial glucose. You want to do PT, PTT. You want to do knee X-ray, that's a specific one. And then you want to do a blood culture. That's a specific too. And then you find thick, purulent fluid, difficult to aspirate on the synovial.
Mm-hmm.
And then one thing you want to order, you want to give morphine. Okay, that's an important one. One time. And then you give Tylenol, continuous. And then you want to order ceftriaxone, right?
Mm-hmm.
After
I do.
erythrosynthesis. Okay, because you don't want to confuse the results. And then you give vancomycin, IV.
Is this, what about the ceftriaxone? Is that IV?
Huh? Yeah, IV, both IV. And then, because you did the V-panic, and then you consult ortho. Yeah, because once you do the V-panic, you want to put most of like medication IV, because there is IV excess already. Then you consult ortho, okay, and then get consult. Once you get that consult, you want to order something very important, which is called arthroscopy. A lot of people forget to order that, and that's a very important thing in septic arthritis because it's an abscess. Antibiotic alone may not be enough. That's why you want to do that. And then get the procedure done. After that, you want to cancel NPO, or this is let me write it this way: switch NPO to normal diet. Okay, and then you want to follow up Q 6 to 12 hours, and then cancel. And that's it, you're done for this patient. You see, it's very interesting, nice, and smooth.
Yeah.
Okay, let's. Okay, now let's go to the next case. Which what we call dysfunctional uterine bleeding. This one you want to do. You want to do a complete physical exam. And then you want to order HCG plus the cut to gleam. Plus you want to order the prolactin, PT-INR, PTT, TSH, those included in the mnemonic. And then you do pap smear. And then, go send him home. Follow up in 1 week. Okay?
So this time we don't give her meds, right?
Yeah, you don't give them. And then when you follow up with 1 week, everything within normal limit, then you want to give oral contraceptive pill, low estrogen, and progesterone. And you want to give them iron, sulfate, oral, and then you want to follow up in 3 months. You're good to go. Final orders, there's no need for final orders in this patient, like the 2-minute screen.
Okay. Oh, yeah.
Now, this is what you want to do: acute pericarditis. the second case, acute pericarditis. The first thing, it's in the emergency room. You want to do ER, police BS. Okay, and then followed by focus physical exam. After that, you get EKG. You find ST elevation. Okay, after that you want to order the cut gleam, and then you want to give the cardiac enzymes that's specific. Chest x-rays in the mnemonic. You want to order ESR in the mnemonic. Blood culture. Okay, you want to do colchicine because there's diffuse ST elevation, so this is most likely pericarditis. Give them colchicine, ibuprofen. Cardiac enzymes, a blood culture, and then you want to admit. Admit, order V-panic. Okay, you can let him ambulate at well. Regular diet. Then you want to order echo. This is important. After that, you don't need the oxygen. Just cancel oxygen. And then cancel oxygen and get echo results. Okay? Once you get the echo result, you will find pericardial effusion, but not tamponade. So you don't need to order pericardiocentesis. So after that, you want to cancel cardiac monitor, BP monitor. You don't need it. IV access. You don't need that anymore. And then you follow up like a Q 8 hours till symptoms improve. And then cancel vitals and order counseling. And then you want to follow up in 2 weeks. Okay, after you send him home. So that's the summary of the acute pericarditis case management. Now, this is a very good case, and it's on the it's kind of tough, so you gotta be careful for this one, which is subcapsular splenic hematoma. Okay, this is what you want to do first. So this is present after motor vehicle accident. So the first thing you want to do, cervical spine immobilization. And then you want to do the police BS. Okay, after that you want to do complete physical exam. After which you want to do blood type because there's risk of bleeding stuff. And then you want to order the cut gleam mnemonic. Urinalysis, you want to order ABG. You want to do EKGs, amylase, lipase. You want to do lipase, amylase. You want to do PT, PTT, INR, blood alcohol level. Because it could be intoxicated. You want to do urine toxicology screen. And then you want to do beta HCG, this is a female. And then you want to do spine x-ray, chest x-ray, abdominal CT, put him on NBO and consult surgery. Okay, and then you manage the symptoms by morphine and Phenergan. Okay, after that you get CT results. Advance the clock, get CT results. After you get the CT results, you notice that there is a subcapsular splenic hematoma in the CT result. Then you want to admit. You can admit to ICU or inpatient, it doesn't matter. And then, but you want to order V-panic. And then you want to order Foley catheter. And urine output like with the V-panic, that's it. And then cancel cervical spine immobilization once you ruled out spinal injury. After that, you want to do follow-up Q 4 to 6 hours. Okay? And then you want to do follow-up Q day every day. Okay? Okay, if the patient is stable for 24 hours, then in this case you can discharge and follow up in outpatient in 1 to 2 weeks. Okay?
Okay.
And then you want to just counsel after that. Give him vaccine, maybe that's an important one if you take this. Because splenic hematoma, you may not need to do splenectomy. So this way we do not want to have to do splenectomy. You do splenectomy if there is a persistent hypotension despite IV fluid and stuff. So that's okay. Now we'll discuss cellulitis case. Okay, it's an important case. The first thing you want to do focus physical exam. Once you notice it's cellulitis, then you want to admit to the inpatient. You want to order V-panic, cutting. You don't lose points. You can order cutting. That's okay. And then you order X-ray of tibia and fibula. You want to do blood culture, IV excess, IV fluid, and then what antibiotics do you give? You want to give IV clindamycin. You want to give Percocet oral. You want to put him on bed rest with bathroom privileges and normal diet. You don't need to put him on NPO because his leg is having the problem. Unless it's a GI issue, then you don't need to put an NPO.
Okay.
And then you follow up Q day. Till no symptoms. Once the patient improves, then you want to switch IV to PO, clindamycin. Okay? And then you send the patient home and follow up in 1 to 2 weeks. Okay? So that's the summary of cellulitis. You want to admit V-panic, X-ray of tibia and fibula, blood culture, IV clindamycin, and then you want to follow up every 1 day, and then you switch IV clindamycin to PO clindamycin, and then you follow up 1 to 2 weeks. Okay. Okay. Now we're gonna talk about acute gout. The first thing you want to do focus physical exam. After that, you want to order the cut gleam mnemonic. And then you want to do ESR, BMP, PT, PTT. You want to do foot X-ray. You want to order synovial fluid, cell count, synovial glucose, crystal, culture sensitivity, viscosity. And then you want to give him indomethacin if he doesn't have a renal failure. And then you send him home, counsel, and home. After that, you want to follow up in 1 to 2 weeks. Okay? And then you will find monosodium urate crystal in the synovial, which you don't need. You already managed. It's ibuprofen. Okay, the patient will improve, and that's it. The case will end. Okay, now let's do the 28th case. Now it's a pretty long case and it's a nice case. 2 conditions at the same time. It's called PCP. Okay. So first, the patient is in the office, so you want to do complete physical exam. Once you have high suspicion of a PCP pneumonia, then you want to do emergency room. You want to order the police BS mnemonic. Then you want to do cut gleam. Okay? And then get the pulse ox. Pulse ox, you will find the pulse ox decreased. Okay? When pulse ox below 93. Then you want to order the ABG because that's going to change the management. And then get the ABG results on chest x-ray. You'll find bilateral interstitial infiltrate and hypoxia. Then at this point, the PO2 is 68, so you have to add steroid to TMP-SMX. So there's severe PCP, high on the differential. Now, what you want to do, you want to give empiric antibiotics and you want to admit to the inpatient because this is a serious condition. We got to admit him. You got to do V-panic plus TMP, SMX. Okay, and then you want to add.
Wait, why are you giving him antibiotics?
Hmm?
Why are you giving him antibiotics?
It's a PCP, pneumocystis pneumonia.
Oh, pneumocystis, not the drug. Never mind.
Yeah. So you
I
give it,
think.
and then because he's hypoxia, so you give if it's a PO2 less than 70, then you want to give prednisone,
Okay.
and then you want to
The
do sputum. Okay, sputum for.
trimethoprim is IV, right?
No, you can give it oral.
Or
That's a good point you put up. You're gonna put oral TMP-SMX and PO prednisone, and then you want to do sputum pneumocystis. That's an important one, and other stuff you can order it. You don't lose the points. Then you want to do lactate dehydrogenase, and then you want to something very important. You want to order G6PD because TMP-SMX they have risk of hemolysis in G6PD, so you want to check that. And then you want to test them for HIV ELISA. That's an important. And then there's something you want to do pulse ox every day, Q day, okay, during their hospital stay. Okay, after you do the pulse ox, you get the pneumocystis positive, HIV positive, and you get HIV results. After that, you want to do Western blot. And what else? You want to do CD4 count, and you want to do HIV viral load. And then you follow up Q day every day till symptoms improve because you did everything. Once symptoms improve, you want to give vaccine, which is influenza and PCV 13 pneumococcal. And then you want to give him antibiotics for his HIV. You want to give him efavirenz, PO, all of them PO.
wait. Don't we wait for 2 weeks to give
To
him the
know
efavirenz and all that?
for no, you can give him that. That's not a cryptococcal meningitis. You may wait.
But I thought they would get that iris thing.
Yeah, but this patient improved already, so you wait for him every, like couple of days.
It's gonna be a few days out.
Yeah, so a few days after, it's not 2 weeks. Like once the chest X-ray is fine, then you can order even CBC BMP every day. That's also you can do that. Pulse ox, you will find the pulse ox will improve. So you want to give the triple therapy for HIV. You want to give him tenofovir, efavirenz, and then amitricitabine, PO. And then that's what you want to do. You want to cancel oxygen therapy, pulse ox, and vitals, and counsel. Okay, send him home and follow up in outpatient clinic 3 to 6 weeks. Okay, and that's it. You see, that's probably the longest case
Yeah.
that we have. Yeah. Good.
Hold on, let me put in.
Okay, now let's go to the next one, which is a renal cell carcinoma. Okay. So this is a very interesting case. The patient will present with fatigue. That's it. Okay, you want to do fatigue. So in the office, so you want to do complete physical exam. Okay, and then you want to order cut gleam. Okay, you want to do iron, TIBC. That's an important one here. Ferritin. Okay, and then you send him home. And then you follow up in 1 to 2 weeks. Once the patient returns, you find microscopic hematuria on your analysis. Then this is what you want to do after you find hematuria on your analysis. Then renal cell carcinoma is high on the differential right now. So you want to do physical exam interval history, and then you want to order abdominal CT. Okay? And then you send him home, follow up in 1 to 2 weeks. Okay, so the second time. After follow up, you found renal cell carcinoma, you found renal mass. That's how they describe it. Then, when you have a renal mass, then you gotta admit him, order V panic, vitals IV normal saline, PT, PTT. You can do NBC, pipette, mnemonic, NBC, blood type, cross match, and then you wanna search for metastasis. So you wanna do chest CT scan, oncology consult, surgery consult, and then you wanna order cancer diagnosis counseling. Okay?
What kind of surgery? General?
Yeah, general, that's fine. Okay, and then you advance the clock to get the CT results of the chest and stuff. Get chest CT results. And then you want to give him cefazolin IV one time. And you want to order nephrectomy. And then get the procedure done, advance. Okay, after you get the procedure done, you re-evaluate, you do follow-up, Q 12 to 24 hour with interval history and physical exam until patient is ready for discharge. Okay, give pain pills if needed. And that's it. After that, all what you want to do, you want to cancel the NPO and give
Wait,
regular
don't you do radiation, chemo, and all that stuff?
regular diet, no smoking. What is it?
Don't you do radiation, chemo, all that stuff for this particular patient?
No, it was stage 1 renal cell carcinoma,
Oh.
so you just take it out and you're good. Okay. 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 Now we have the case 30. It's a very important case called perforated duodenal ulcer.
1 second. Give me 1 second, okay?
Okay, so when you have a perforated duodenal ulcer, okay, present in the emergency room, so you want to do police BS, which is pulse ox, oxygen, cardiac monitor, blood pressure monitor, EKG, IVXS. After that, you want to do focus physical exam. Okay? After that, you want to order the cut gleam. You want to order lipase, amylase, abdominal x-ray, that's an important one. And beyond, then you want to cancel the ibuprofen that he has. And then get results. Now, once you get the results, what you want to do, you want to do the, you want to get the NBC pipette, because in case you're gonna need surgery for sure, plus the NG tube, nasogastric suction, consult surgery, you order bed rest, urine output input, manage the pain, give him morphine, Phenergan, and then what antibiotics do you want to give?
Cefazolin or Metro.
You can give him ampicillin, sulbactam, or you can give metro clindamycin, ampicillin, sulbactam IV. And then you want to admit V panic. Okay? Get consult. After you get the consult, you want to, this is important, you don't want to order surgery before the consult. Consult the surgery and then you order laparotomy.
Regular general surgery? General surgery?
Yeah, general surgeon can do it easily, yeah. They do it all the time. After that, you want to do laparotomy, okay, and then get the procedure done, which is surgical repair of the duodenum. That's it. Get surgery done. So when you order laparotomy, they're gonna fix whatever problem there. So
Mm-hmm. Wait, let me go over that again, please.
what is it?
I just want to go over it again while he's done. X-ray. So when you order abdominal X-ray, it gives like a couple of things: acute abdominal series, abdominal X-ray. Which one do you choose?
No, just regular abdominal X-ray. That's just one
Okay.
picture. No need for series or anything. Just you're looking for air under diaphragm. That's it. It's gonna tell
Okay.
you air under diaphragm, and then after you did the admit laparotomy consult, this is what you want to do. You want to follow up Q 4 to 6 hours. This is short simulated time, and then that's
Mm-hmm.
what you want to do. You want to counsel, order clear liquid diet, and cancel NPO. That's it. You're good to go for this case.
Mm-hmm.
Okay?
The antibiotic, you give it one time, right? The antipill and sulbactam.
Why do you think one time?
Because you're taking the patient into surgery.
No.
So
So
before.
this antibiotics is not just for surgery.
Mm-hmm.
I'm giving it for an infection. It could be an infectious.
Ah, so they
So
continue.
it's a perforated ulcer that caused peritonitis. So it's an infection of the abdomen.
Okay, got it.
Okay, now let's do Turner syndrome. So this is what you want to do. First, you want to do a complete physical exam. You will find webbed neck and this stuff. And then you want to order karyotype, order FSH, and order LH. Okay?
Uh-huh.
And then you want to send home. Okay, follow up in 1 to 2 weeks. Okay?
Mm-hmm.
And then you will find the result, like that's XO, 45XO, and high LH, FSH. So after that, what do you want to do? Now this is confirmed Turner syndrome. So I want to screen for the comorbidities with Turner syndrome, which is I want to do fasting glucose. Like that's in the 2 weeks visit. I want to do fasting glucose. I want to
Mm-hmm.
do BMP, urinalysis. See, this is those in the mnemonic. Fasting glucose, BMP, lipid profile, TSH in the mnemonic. I want to do renal ultrasound. I want to do pelvic ultrasound. I want to do echo, the skeletal survey. I want to do hearing test. And then there is something important that I want to do. I want to give growth hormone therapy, subcutaneous, continuous. And then you want to give estrogen, progesterone, PO, continuous. Then you want to give vitamin D. Then you want to do dietary consult. You want to consult psych. And then you want to do counseling. That's in the second visit. Then you send home. Do follow up in 1 to 2 weeks. And that's it. Your job is done.
Mm-hmm. Okay. That was a long one too.
Yeah. 3 visits.
Mm-hmm.
No, this is a very important case too. It's essential hypertension. That's an important one. You don't want to start antibiotics like antihypertensive immediately.
Yeah.
So first you want to do CBC plus complete physical exam, I mean. And then you want to order the cut gleam, the EKG, and then counsel lifestyle changes. So from first visit, you want to counsel on lifestyle changes.
Okay.
Okay, and then you send home. Follow up 4 to 12 weeks. So remember, don't bring
Give
him
me one
back
second.
in like in two
One
weeks or
second.
so.
I gotta enter this slowly.
Okay, so yeah, the first visit, just counsel him on lifestyle modification, low fat, low carbohydrate diet, and then you follow up with him. Just focus on the timing. This is very important in the CCS. Like 4 to 12 weeks, 2 months.
Okay.
It's not in 2 weeks, 2 months.
Okay.
And then that once labs everything is fine, when he comes to the office, you
Mm-hmm.
measure blood pressure is still in 150 over
Mm-hmm.
95.
Okay.
Okay. Then in the second visit, what do? You want to do interval history, physical exam.
Mm-hmm.
Okay, and that's it. You don't do anything else. You don't start medication the second visit, and then you follow up with him in
Mm-hmm.
3 to 5 months.
3 to 5 months.
So
Okay.
first 2 months and then 3 to 5 months.
Mm-hmm.
After you follow up with him 3 to 5 months,
Mm-hmm.
okay. So at this point, when the patient arrive after how much 2 months and then 5 months, how much is that? Like
Mm-hmm.
6 months, okay.
Yeah. About 7. Yeah.
6 months of lifestyle changes
Mm-hmm.
and still hypertensive.
Mm-hmm.
Okay, then in this case you want to order amlodipine. PO, the first line for
Okay.
hypertension. And then you want to follow, you want to send home. And then you want to follow up, okay, in 4 to 6 weeks.
Okay.
Okay?
Okay.
And then on the follow up, patient has no hypertensive. Hypertension is better.
Okay.
Patient hypertension is better in 1 month of treatment.
Mm-hmm.
Okay, then in this case you want to send him home again. And then how often do you follow up with him? You follow up in 6 to 12 months. That's it. If he doesn't have any problem, why would we bring him here?
Mm-hmm.
Okay, that's it. Just
Okay.
like regular annual checkup, something like that.
Excuse me. So in the lifestyle changes, what kind of changes are you recommending besides the diet?
Exercise program.
Mm-hmm.
Yeah, weight loss diet, exercise program. That's it.
Okay. Okay. Cigarette smoking and all that, right?
Yeah. Okay, now let's do acute diverticulitis. Ouch. What happened? Okay. Yeah, so for patient with acute diverticulitis, this is what you want to do first. First, you want to focus physical,
Mm-hmm.
and then you want to do CBC, blood culture. This is in the mnemonic, so we don't need to write it down. You want to do CBC, blood culture, BMP, urinalysis, and then you want to do abdominal X-ray. You want to do abdominal CT. Okay, you want to do IV access. That's in the mnemonic.
Mm-hmm.
I present it to the ER, so we do police BS. And then you want to give him ampicillin sulbactam, like the perforation, peritonitis.
Okay.
This is a good regimen for abdominal infections. Then you give morphine, Phenergan, and then get CT results. After you find leukocytosis and diverticulitis in the CT, so this you diagnose and manage them symptomatically in the ER. After that, you want to
Okay.
admit him to the inpatient. You order the V-panic. Okay, do bed rest and these types of things, and then you just want to follow up every 12 to 24 hour with interval history and stuff. After that, once patient improve, Then this is what you want to do after the patient improve. You want to cancel NPO, vitals, IV antibiotics, IV excess, saline, IV morphine, IV Phenergan. You want to cancel all of that. And then you want to give PO Percocet. It's an important one. You give PO metronidazole. You give PO ciprofloxacin. You want an advanced diet and do counseling. After that, send him home. Then you want to do follow up 2 to 6 weeks. Okay? Once the patient improves, and that's it, you're good to go. Okay?
Okay.
Now we have a case of a child abuse. Okay, so the first thing you want to do is the complete physical exam. You will find different stages of healing, bruises, trauma, and then you want to order cut, gleam. Okay, you want to order bleeding time, chest X-ray, pulse ox. So you want to do police BS, mnemonic, ER orders, and then you want to get the results of the chest X-ray. That's an important. Then you will find rib fracture in the chest X-ray. Okay. So now it's changed from a child abuse with a rib fracture. How you manage rib fracture? You want to give him ibuprofen. You want to give him chest physiotherapy. You want to give him regular diet. You want to do CPS consultation, Child Protective Services consultation. You want to do psych consult, and then parent counseling. After that, you want to admit. You don't need the
Well, what
panic,
about
huh?
Child Protective Services?
What is it?
Child Protective Services.
Yeah, we admit him till we get the Child Protective Services, and then you get the CPS consult. What is it? What's your question about CPS consult?
I was thinking it should be done before admission.
Yeah, we did it. We did them, and then we admitted him, and then we wait for the CPS consult.
Okay.
Okay.
Mm-hmm.
And then you keep him inpatient. Get the consult recommendation, and this is what I want you to do. You want to do follow up, Q12 to 24 hour. Okay, and that's it. So this is for a child abuse case. Okay. So let's do a rapid review for the cases that we did for today.
Sure.
So we discussed the acute appendicitis case. First you do the police BS mnemonic, and then you want to do abdominal ultrasound, abdominal x-ray. You want to treat the symptoms, give IV cefoxitin, consult surgery, and then you order appendectomy. And then the timing is 4 to 8 hours. Septic arthritis, you want to do synovial, that's important, knee x-ray. You give him ceftriaxone, vancomycin, arthrocentesis. Get the ortho consult, order arthroscopy. And you follow up 6 to 12 hours. Dysfunctional uterine bleeding, you want to do prolactin. You want to do pap smear, and then you follow up 1 week. Order oral contraceptive pills and iron. Acute pericarditis, you want to do the cut gleam, police BS, cardiac enzyme. You want to give colchicine, ibuprofen. And then you want to order regular diet. You want to order the echo, and then you want to follow up every 8 hours. Subcapsular hematoma, you want to do the police BS, cut gleam, IBG, lipase, blood alcohol, urine toxicology, beta HCG, spine X-ray, abdominal CT, treat the symptoms, give Vivi panic, and then you just follow up. That's about it. Cellulitis, you want to do X-ray of the right tibia, blood culture, give IV clindamycin, and then once improved, convert it to PO clindamycin. Gout, you want to do foot X-ray, and then you want to give him indomethacin. PCP, you want to do the police BS or the IBG, and give him TMP SMX and prednisone. you order lactate dehydrogenase for hemolysis G6PD. After that, you test for HIV. Once it's positive, you want to start efavirenz, tenofovir, amitriptyline. So remember these things. Those are the one that had least side effects. Okay. So good.
Okay.
And then you want to follow up in 3 to 6 weeks. Renal cell carcinoma is that someone present with fatigue. You have hematuria on urinalysis. You want to do abdominal CT. You found a renal mass. Then you want to order nephrectomy. Get the surgery done. Follow up 12 to 24 hours. Give pain pill. Okay, and that's it. Perforated duodenal ulcer, you want to do lipase, amylase, abdominal x-ray, cancel ibuprofen. You want to do the NPC bibite mnemonics, consult surgery, admit, get order laparotomy, follow up 4 to 6 hours. Turner syndrome, you want to order karyotype, FSH, LH. Okay, once that fine, you want to do skeletal survey, pelvic ultrasound, glucose, hearing test, you know why. And then you want to order growth hormone, estrogen, progesterone, vitamin D, dietary consult, and that's it. Essential hypertension, you want to keep them on lifestyle changes for 6 months, and then if they did not improve, then you would start them on amlodipine, and you follow up every 6 to 12 months. Acute diverticulitis, you want to order abdominal x-ray, give them ampicillin, sulbactam, and morphine. Okay, and then once you stabilize, you want to switch the antibiotics to PO metronidazole, PO ciprofloxacin, and then you give him Percocet for pain. Child abuse case, you want to do police PS, give him ibuprofen for rib fracture, and then you want to get the child protective services consult. Wait for the consult and counsel every 12 to 24 hours.
Mm-hmm.
And that is it. That's a summary of this second part of the CCS. I think we'll do tomorrow one more session and think hopefully we'll be done with everything, okay?